Well, welcome to the third in our series of COVID-19 podcasts. The topic of this podcast is the new National Surveillance Programme on Neurological Complications of COVID-19, or CoroNerve. I'm not sure if I've said that right, Ben, but I'm sure that you'll correct me as we go on. Dr. Benedict Michael is spearheading this group, and I was delighted to be invited to form part of the steering group on the study. Ben's also an Encephalitis Society trustee and vice chair of our scientific advisory panel, so I'm especially delighted to welcome you to this podcast, Ben. Would you like to say a few words about who you are, what you do, and any work that you've been involved with relating to COVID-19 outbreak? Sure.
Well, firstly, thanks very much for having me. It's one of my more pleasant Zoom conferences that I've been having to deal with. For those that don't know me, I'm a senior clinician scientist fellow and a consultant neurologist. And I work on the wards caring for patients with neurological infections like encephalitis, and in the lab trying to understand how viruses cause encephalitis, trying to develop targets to reduce brain swelling. During the COVID-19 pandemic, I've been involved largely with caring for patients who've had neurological complications of COVID-19, being redeployed, which we can talk a bit more about later on, and also the national surveillance study, which I talked about.
I can hear a little baby in the background. Are we going to have one of those viral moments where the door behind you opens and children run in and someone's going to grab them?
Quite possibly, yeah.
Well, look, it's the first time that we've had the chance to talk properly in a while, given how busy you've been. How are you?
The honest answer? Knackered. Knackered. In terms of clinical neurological infectious diseases, there's not that many of us. And, we're increasingly recognizing that a relatively small proportion are developing neurological complications, but they're often those that are really severely affected. And that's why we've been really working hard to move at pace to get a national surveillance study up at a speed I've just unheard of in comparison to some other studies I've been involved with, where it can take 9 or 12 months or longer even to get going. So I'm grateful to all the study management group and all our collaborators that have made that possible, really.
Great. Well, we're going to talk quite a bit about that new programme because it's super exciting. But at the moment, for viewers that are watching, what's your typical working day during a COVID-19 outbreak? What does it look like?
Yeah, I wish there was a typical day. So from a research point of view, as I sort of alluded to earlier on, it's constant Zoom conferences throughout the day to make sure all the various collaborators across the specialities are working together cohesively and aligned and taking this forward in the same direction. But then, as you can see, I'm off to the hospital any minute as soon as we finished to help out really wherever we're needed. And we're doing kind of crazy shifts and some strange nights and odd patterns and working in specialties we're not used to, in hospitals we're not used to, but just all trying to chip in where we can.
So how have you and your colleagues been managing?
So far, so good, really. Actually, things have been going well. I think it's fair to say there's been a lot of collegiate working across specialities and between hospitals that wouldn't normally be so collegiate. So it's working well. Everyone's pulling together. It's great. Nurses that are used to being just dealing with very stable outpatients are now on acute wards where sick patients are being admitted. Neurologists that are used to doing sort of long-term diseases like dementia are now on the front line doing stroke and things where, you really acute management makes a huge difference. But it has been hard though, really, at times. So on the wards where we have, we're isolating the patients who are positive for SARS-CoV-2, so that the COVID-19 patients, it's heartbreaking because you see colleagues breaking down. I know some pretty tough, Scouse nurses who are sort of breaking down on a nearly daily basis. But of course, it's even harder for the relatives and the loved ones of those affected. So we sort of got to take it on the chin and just crack on, really.
Do things like clap for NHS help with morale, do you think?
Yeah, absolutely. Absolutely. It don't underestimate what a huge difference it makes. People were out with their vuvuzelas and their horns and things last night on our street. And when I get the chance, I had to take the kids out, on their daily bike ride to get a bit of fresh air and exercise and, get out the crazy. Seeing the chalk paintings on the streets that people have done for the NHS and the rainbows in the kids have drawn in their windows. I think it really brings us all together. It's great.
That's amazing. What are your thoughts on how long the pandemic and self-distancing will last?
Well, there's some things we know and there's some things we don't, right? But I mean, as of yesterday, we know it's going to be another 3 weeks of what we've been doing for the last 3 weeks. And it looks increasingly like even once the isolated home policy is lifted, we're likely to have some form of restrictions. Exactly how that will look is unclear, but some form of social distancing policy is inevitable to for us all to pull together to reduce the chances of there being a severe second peak further down the line.
Yeah. Have you got any advice for people who are listening to this podcast?
So as anyone that knows me will know, I'm not a huge fan of this current government, but I can say that unlike in many other countries, and for example, I lived in the US for a while, our government do largely seem to be following the advice of scientists and public health experts. And look, we can already see that our collective action is having an effect in terms of reducing that exponential curve that we were seeing at the beginning. So my advice to people would be keep it up. What you're doing is working.
Yeah, that sounds like good advice, and I agree with you on your government perspective. We've had many chats. We share political views, but like you, actually, I think that they've done probably a really good job and have worked very, very well with Public Health England and the various other national and international advice that they've been taking. So overall, I agree with you. But let's move to this national surveillance programme. So what is the National Surveillance Programme on Neurological Complications of COVID-19 and why has it been created?
So it first began with anecdotal reports that we were hearing either from colleagues or a couple of cases that initially came out of China where people had severe neurological complications during the course of their COVID-19 infection. And actually during the H1N1, the swine flu pandemic, I helped lead the national surveillance study here in the UK then. And what we realised was that, as I mentioned, although it's a small percentage, they're the severely affected patients. And when one looks at a pandemic infection at a population level, it's very easy to miss the granularity, the detail of this smaller population that can easily be missed. So I realised we needed to have a collaborative approach across specialities, across hospitals, across geographical regions, with interested parties, not just at a population level, but at the patient level. What's happening out there? Because look, there are critical questions we don't currently have the answers to. Who is it that's at risk of developing neurological complications of COVID-19? When they do develop complications, are they complications affecting the brain or the spinal cord or the peripheral nerves? And we also don't know what the heterogeneous sorts of different treatments patients are receiving out there. And then we don't know how patients are doing in terms of their outcomes. And really, we're going to answer these critical questions. We've got to come together. We've got to collect patients from across these regions to try and start to answer these questions.
Yeah, so who's involved and what is the programme going to entail?
So, I mean, I've been absolutely delighted that really everyone has come together in the scientific and the medical community in a really fantastic way. So we are an amalgamation of a number of professional bodies, including, but not limited to, the Association of British Neurologists, the British Paediatric Neurology Association, the British Association of Stroke Physicians, the Royal College of Psychiatrists, the National Encephalitis Multidisciplinary Team, amongst many, many others. And what we have done is we've set up a surveillance network where they are all contacting their membership on a regular basis to ask them to complete a very, very short notification form that takes literally 3 or 4 minutes, so that busy doctors on busy wards can quickly input their data, so we get the denominator data on what's the demography of the patients they're seeing, which hospitals, and in particular, what of the various sorts of neurological complications that can happen they're seeing. And then at that point, when we've got that notification data, we're then asking the doctors to complete a more detailed case record form, which will allow us to understand really a little bit more about the patient's symptoms and signs, what their investigations look like, for example, what their cerebrospinal fluid testing showed, how confident can we be that it's COVID-19 that's related to that neurological problem, and as I say, how the patients do, so that we can really engage with understanding which patients will do well and unfortunately which patients are likely to do poorly.
Mm. What's going to be the process of the programme going forward? What does it look like in terms of, so people have done reporting of their patients, then what's going to happen?
So it's really important that we act in a timely manner, in this context. So what we're planning to do is regular updates to the professional bodies and the wider medical and allied communities, in part through early preprint scientific publications, but also making sure that we raise awareness of our work through social media, through our social networks and our collaborators like the Encephalitis Society, so that we can really help to inform clinicians on the front line who may only see a couple of cases, but if they've got a wealth of knowledge of 50 similar cases to draw on, it's going to really help inform their practice in a timely fashion.
Right. Do you think then that we're going to be seeing neurological complications from COVID-19 for survivors?
Yeah, so that's an interesting question. Thus far, the patients that we're aware of that have had neurological complications have developed them at the time of their COVID-19 disease. So they are sick in hospital with severe respiratory problems and fevers at the time they develop the neurological problems. We haven't yet had cases where people have recovered from COVID-19, excuse me, and subsequently developed a neurological problem. But, we're being vigilant, we're keeping the surveillance program running, and we will be looking for that early if that is occurring.
What type of neurological complications do you think can be expected, or is that an unknown at the moment?
Well, there's a few things we know. There have been some cases of encephalitis reported in the literature, although unfortunately, particularly the cases reported from China have been lacking in detail for us to be confident that it was really true encephalitis. Certainly we see encephalopathy, which is, as you all know, the broad syndrome of an altered mental state or confusion or coma, but not necessarily with evidence of brain inflammation, for example, on the spinal fluid or on the brain imaging, although there has been one case from the US where it very clearly was acute necrotizing encephalitis, which is a very severe form of encephalitis. Mm. What has been a little bit of a surprise is that we're seeing stroke, and we're seeing quite a lot of stroke. What is yet to be determined is how much that is, excuse me, someone who's had very severe COVID-19 and they were at risk of a stroke anyway, and therefore they've had a stroke, or how much, because the body was under stress, or how much that is a direct active effect of COVID-19. What I can say is that we are seeing strokes in patients with COVID-19 who don't have the conventional risk factors like diabetes and smoking and high cholesterol, etc. So we have to be vigilant to the possibility that COVID-19 may be directly attributable to these strokes. And what we also don't know, and this sort of goes to your previous question about what might happen to those that have survived, is whether there might be a proportion who develop an autoimmune encephalitis after they've recovered from the infection. And that's one of the things that we'll be looking out for.
Wow. Is there anything else that you'd like viewers to know about the National Surveillance Programme?
So not specifically about the National Surveillance Programme, but other than to say we have some experience from other respiratory virus pandemics, from SARS, from MERS, as I mentioned, from H1N1. So I wouldn't want them to think that the medical community is completely flying blind here. We have some evidence from the literature to draw on, but given the ability of this current virus to seemingly transmit from person to person so actively and cause a pandemic on such scale so rapidly, we are going to have a very high denominator for who this smaller percentage develop neurological complications are. So perhaps for the first time, this is an opportunity for us to really start to understand who is at risk and how to, identify them and start treatment early.
Mm. Well, obviously the National Surveillance Programme is incredibly important, and as well as having, many of our ordinary interested members viewing this podcast, we know that many of our professional members will also be viewing the podcast. So where do people go to report these cases?
So if you are a member of the Association of British Neurologists or the Paediatric Association or the Stroke Association or the Psychiatrists, you could just go to your professional body's website. Most of them are live or going online very soon, i.e. within hours or days. Or failing that, go to our website at www.coronerve.com, where you'll find a little bit more information about what we're doing and a notification form, at least get the ball rolling.
Oh, that's great, thank you. For anybody that can hear it, I'm sorry, my dog's barking now in the background.
We don't need to drown out the children.
Well, thanks very much, Ben. Is there anything else that you want to ask us or anything before I say some closing remarks?
Well, as a charity, and having been on the board of trustees, I know this must be a really difficult time for the charity. You've got people working from home, you've got, across the charitable sector, lost income, and then that combined with the dual difficulty of having more people to do, to help. I'm sure you're getting thousands of calls from across the globe with people who are worried about encephalitis and COVID-19. How are things going? How are things going at the charity?
Yeah, I mean, you're absolutely right. I mean, our calls for support have doubled. I think part of that is people's anxieties around this, but also, from families, as you've described, who've got relatives in hospital with neurological complications. So certainly the demand for our services has doubled. Income has plummeted. People shouldn't underestimate, we've had all of our fundraising events, over the next few months, we had like 80 fundraising events. None of them can take place. We don't have much money in the bank, which as a trustee, you'll already know, but what little we did have that was invested was, almost wiped out overnight when all of this took place. And then of course, we also have corporate supporters as well who give to us financially, and those gifts, I think, there's a big question mark over them because people are not able to go to work and operate their businesses. So I think, am I losing sleep over it? I think the answer to that is yes.
Yeah, I mean, it's really important that people support the important work that you guys at the Encephalitis Society do as much as they can now more than ever, really. Yeah, absolutely. I think it's critical. I think that people understand. I think we're in an okay place at the moment. We, being an international organisation that operates around the world, we were already very well set up digitally, and I think that's been a huge bonus for us. So we were able to migrate. The senior team, migrated everybody to home working within about 5 days. And we had most of the digital things already in place that we needed. There was a little bit of computer equipment that needed to be bought, which we were able to action really quickly. But they did an incredible job as soon as we realised what was happening of migrating all of our team to home working. We're super keen to make sure that everybody's morale is kept up. We're keeping all of our team working. We haven't furloughed anybody because we need them. We're operating around the world and we've got a staff group of 12 and they're all, we need to keep every one of them on the day job. And so, we do need people's support, absolutely, now more than ever. Yeah, absolutely. Absolutely.
Well, look, as we bring this podcast to a close, is there anything else that you'd like to say before I make a few kind of closing remarks?
Only one thing, really. I mean, actually, genuinely never before in peacetime or in our lifetimes have we actually seen the impact that collective action can have. And when we come out of this, and we will, I hope really that all of us keep the memory of this time. A time when we valued our NHS staff, our social care staff, our charity sector, in our supply chain of food, even. And if we can apply the experiences from this, going forward, we can significantly address the problems we have in our health and social care infrastructure, the support of our charitable sector, and the collective action that's needed for our planet. And, despite the tragedies of this time, maybe we might have an even brighter future on the other side.
Yeah, I think, wise words, as I would always expect from you, Ben. We've covered quite a lot of questions. We're really, really grateful to you taking time out of what's probably, going to be one of the busiest times of your careers. And we're all deeply grateful to people like you who are on the front line. And, on behalf of all of our members, please accept our deep and grateful thanks for all that you do, along with the rest of our trustees and our scientific advisors. We also want to, as we finish up, reassure viewers that the Encephalitis Society services remain unaffected by this outbreak. So if people who are watching feel that they want any support or information, then the teams are still active and still working, and they can go to encephalitis.info for contact details or to chat online with someone. But as Ben said, and as I said, if anybody watching this can support our work at this really challenging time, then please visit encephalitis.info/donate. And most of all, wash your hands and stay safe, everybody. Ben, thank you so much for doing this.
It's been an absolute pleasure. Thank you.
Thank you.